We'll get all of you in, I promise.
Over 90% of the marijuana cards issued, 40,000 cards were issued, 90% of them were for what? Chronic pain. They were not for cancer, they weren't for seizures, or any of these other things. So we've said all along that this is simply a backdoor effort for people to ride the coattails of sick people to be able to be healthy and smoke marijuana and grow it.
I know you guys are on the edge of your seat. I love this. This is making my job so easy, but I've got to get down to Beth. She's got a couple people who'd like to ask a question.
Yeah, you think you're on the edge of your seats. These people are. They want to talk, and we have a lot of people. We're not going to get to everybody, but we do have a couple of questions, so I think the best way to do it is maybe ask a question, let the panel respond quickly, and then move on to the second question that we have lined up. One of the very first people to come up to me and say, I have a question to ask is Sharice Dean. Welcome. Thanks for being here tonight. What's your question?
Thank you. It was talked about earlier, but I still did not get a definitive answer of how will the production, the potency, the dosage, the regulation, how will all that be regulated to ensure that I'm safe with medical marijuana, my 4 children are safe, I have a ranging age of children. How will you ensure that the regulation is safe and that it's harmless?
Okay, Ms. Fultz.
With the testing in other states that has already been established, if you go into a dispensary and you go in and you look for the product, each of those are labeled as the amount of the THC, the CBDs, everything that's in it has to be listed, the amounts in it. As far as keeping your children safe, as Dr. Smith and I talked one day, I don't think if you have 4 children, I'm sure you're a very good mother, I don't imagine you leave Tylenol out laying around for your children to get a hold of. It's a medicine like any other medicine. You don't want your children to have it unless they have an illness that the doctor recommends this for. You wouldn't want your children to have it. But that is how they make it safe, and that's how it's tested. Everything has to be labeled very specifically as to what levels every one of the products are in. And can I just say one thing
Absolutely.
about, please?
You've wanted to for 10 minutes.
You were talking about you can't say chronic pain. What do you treat all the time?
Well, I don't treat chronic pain all the time. I treat mostly cancer pain.
Chronic pain. How do you tell that if you can tell they have chronic pain for your medications, why can't they treat
Well, I think all of us have chronic pain.
To say that you can't describe chronic pain, obviously you've never had chronic pain.
Well, I think all of us have. The other point, though, is that when you talk about what comes out of a dispensary, it's not dose related. It's not, we don't know. When you go to a dispensary, you really don't know the dose of drug that you're getting. You don't know exactly what you're getting. And in Colorado and many of the other states where there is medical marijuana, what we find is that kids are getting this because you'll have somebody who go in with a card, they'll get their medicine, they'll give it to their girlfriend, they'll give it to their cousin, they'll give it to anyone, they'll sell it. And so again, as Jerry was saying, the average marijuana user is 32 years old who is also addicted or taking cocaine and methamphetamine, who, again, this is the profile of that person. And so he is there with, quote, chronic pain. And that's really, for us as physicians, that just doesn't compute. You
talked about doses real quick, and we're going to go back to another question. But when you talk about the impurities and the dosage, can that be done, though? Can it be done to where it is safe? In your mind,
if we refine it into CBD, as we say, right now, we in the state of Arkansas, I heard the interview about seizures. First of all, the thing that we need to do when we've got a problem is get us a doctor. And if some child has seizures in Arkansas, they should go to Arkansas Children's Hospital. And so there they can go. And and the head of pediatric neurology that I spoke with a few weeks ago said, every one of the children, there's less than 50 children in the state of Arkansas who have Dravet syndrome. And most of those can be treated with standard drugs. So that small percentage that can't be treated, CBD can only help a small percentage of them. So right now, within driving distance, you can get purified Pedialex, which is a purified CBD similar to Charlotte's Web, where you know what that batch delivers. You don't have to go to Colorado where it may be 20% bioavailable or 80% bioavailable. You can get it, and they'll even pay for the travel there. They'll give you the drug. But even also at the university, they have CBD as part of a research protocol. And this is where we need to go. We've got small numbers of people with these problems. We need good research, because just like all of medicine, for years, I thought digitalis, I did research on it. I thought it was the greatest thing going. Right now, if you ask a doctor, when was the last time you used digitalis? And they'll sort of smile and say, well, it's in my toolbox. It's nice to have the toolbox, but I don't use it. We don't know. A lot of these drugs, we may have far better drugs in the future, or they may be the drug, but we need research to really know, do they make a difference?
All right, very good. Back down to that.
All right, our next audience member with the question is Dan McLaughlin. What's your question?
Well, first I'd like to make a comment and correct Mr. Cox mentioned the IQ drop, which was based on a 2012 Duke University study which followed people for several years and found a 6 to 8 point drop in IQ. However, 6 months later, after being attacked by the scientific community for its poor controls, they did a follow-up and admitted their poor controls, and London School of, I'm apologize, I don't remember the exact school. A school in London did a study with double the participants last year, found absolutely no IQ drop when they controlled the study correctly. As far as Dr. Smith speaking about isolating the constituent parts of marijuana, there's been many studies done showing that marijuana actually has an entourage effect, meaning that the different constituent parts of the plant work together in order to form the proper, to have the proper effect. Now I'll get to my question. I'm a colon cancer survivor. I had a foot of my colon removed in 2013. There's been studies, published medical studies, that show that cannabis can, specifically CBD, can have a chemopreventative effect on a recurrence of colon cancer. My father is an Alzheimer's patient. There have been studies done showing that cannabis completely stops the growth of plaques, which are believed to be the cause of Alzheimer's, and Aricept stops 20%, so it's 5 more times effective than the most used drug currently.
We got to hurry with the question.
Okay. Since the DEA and the NIDA have blocked research at every corner, how long should I wait until myself and my father are dead before we use this?
Go ahead, Mr.
Well,
Dr. Smith.
I think the problem that we have is having anecdotes without refereed journals, without really quality research. When these research articles make it to the New England Journal of Medicine, the American Medical Association, these respectable journals where we have a number of peers who are much smarter than we are up here to analyze and look at the statistical significance, then I think we can accept that. The Duke study has not been rebuked in refereed journals. The best journals are still citing it. So I don't know, but we have some problems.
Okay, just so you guys know, we are about 20 minutes away from ending this thing, and we still have 3 more polls we got to get to with Roby. I'll let you say whatever you want, Mr. Reed. You're first after Roby's poll numbers.
Well, I'm going to throw a curveball to our producer, Rusty, here. I'm going to go to our 3rd series of slides
he's
here.
Not going to like
our
that.
second. I know, but he'll cope with it here. Again, this is public opinion asking what Arkansans think about medical marijuana. When we started getting more specific with those questions, here was the question that we asked. Do you agree or disagree that adults should be allowed to legally use marijuana for medical purposes if a physician prescribes it? 84% said that they would support that, to 14% who said that they would not support that. That is a huge margin and a big difference from the legalization question that we asked earlier. And of that 84% that said that they would support that, 56% strongly agreed that that would be something that they would support. However, if you throw in the caveat, which I believe is in some of the proposals here, do you agree or disagree that adults should be allowed to grow small amounts of marijuana for medical use? The numbers flip back. 51% oppose, 44% say that they agree. So It throws a little bit of confusion in the mix when you look at some different parts of some of the proposals that have been out there in the past and that may be on the ballot in 2016.
Which goes back to regulation, which is kind of what this whole topic has been about.
Yep.
It's not, they don't want it without regulation. Is that pretty much what your polling has
Yep.
found? And Mr. Reed, I'm going to let you go first, I promise, because he's had a hard time jumping in here tonight.
You know, again, to the young lady that asked about the safety, I'm a great-grandfather. I'm a veteran, go to VA. My pharmaceutical locker will kill any kid that gets into it, literally. But I go to prison if I grow a plant in my vegetable garden, and I'm smart enough to go to Colorado and figure out what I need and, you know, or go to the dispensary to get the medicine legal. But getting back to the safety issue, would I rather have cannabis in my medicine cabinet or the opiates? Because if my grandchildren, my great-grandson gets in there, I go to a funeral. Now, the doctor, and I definitely respect his profession. However, in 2013, of the prescribed opiate painkillers, 22,767 people died. And this was direct opiate poisoning, not because of a reaction with the doctor and double medications. Of the 22,767, 71% were opiates, 30% were things like clozapam, clonopin, diazepam, and Xanax. So you talk about safety, I agree, there's lots of research that needs to be done. But in the meantime, we have children at Children's Hospital are dying because they can't get a safe medicine that even if they got too much, they're gonna wake up with the munchies, all right? If you go on my Facebook page, Cannabis News and Information Radio, there's Mr. Nicholas. He's 14 years old. We tried to get the right to try bill passed with vegetable matter in it, and our legislators shot it down, and they're trying to find out a way where this widowed nurse can leave the state to go to a state where this unsafe medicine is available.
Let's get another question and go down to Beth.
Yeah, getting some questions on social media and a lot here in the audience. Really quickly, from one of our social media pages, Jill Field says, I believe the legalization of medical marijuana is long overdue. The relief it provides for chronic conditions is almost liberating. If it was legal, I think less people would have to take addictive pain pills. And next in line here in the audience, the concert hall here, another Mr. Reed. This is Paul Reed. Thank you for being here. What's your question?
Doctor, one thing, how many overdoses have we had on marijuana? Anybody have anything on that? How many? Mr. Cox, you're good. You got figures. How many overdoses have been on marijuana?
Yes, sir. I'll be glad to talk about that, but Dr. Smith probably is more qualified. But first of all, people have overdosed on it. The food-infused marijuana products allow people to ingest a lot more of the drug than they would. Yes, there have been some
I
deaths.
asked how
Yes,
many
sir.
overdoses
Yes,
there
sir.
were. How many
there
deaths?
There have been some. Yes, sir.
Any deaths?
Yes, sir. They
He's
did
saying,
die.
he's saying yes. He's answering
I've
the
answered
question.
yes. Now, but you don't have to die for marijuana to kill you or to bring about your death, just like nobody overdoses by smoking too many cigarettes, but cigarettes kill a lot of people. We all know that. The same thing is true with marijuana. I don't want to be out here on the highway dueling with a bunch of 18-wheelers that are being driven by people that are smoking so-called medical marijuana while they maneuver down the highway. And you can go on down the line and talk about ways that marijuana can bring about death or at least serious injury, and it doesn't have to be a fatal overdose where you just ingested a lot of it and you died.
Let me comment
Go
on
ahead.
that.
Go ahead.
This is exactly the point. We're talking about people using cannabis, and the use by itself kills somebody.
In the state of Colorado, when you look at the literature of what's happening in the emergency rooms, it's really overwhelming. You see teenagers coming in with overdoses. Whether all of them die, they're damaged. When you look again what's happening when these drugs on a public health basis are passed down to children and their brains are formed, this is in the literature. This is not something we're making up. And there is a heightened response and a greater tendency for them to use other things later on. The question about whether or not the IQ, again, that's in the literature. We see children, we all know, and this is well documented in the workplace, when people are using these drugs, like kids in schools, they become apathetic. Their academic performance falls. They lose their drive to achieve. And just like Kirk Bradbury's son, you know, you see this happen over and over. So you see greater tardiness, you see greater absenteeism, you see greater workman's comp, more accidents, more job turnover, less interest in what they're doing, less advancement. So all along the way, these are the effects of these drugs getting into the wrong hands. And again, the number of teenagers, it goes up twice as many in many states where medical marijuana is available. And so this is a huge problem. How you measure it on a public health, is it just about, are they dead, are they not? We look at morbidity just as seriously as we do mortality.
Real quick though, before we go to Beth, we're going to go to Beth. Do you ever see a day where you would prescribe cannabis to a patient?
I will not prescribe cannabis, I will prescribe CBD.
What CBD?
And absolutely,
Same plant.
but it's refined, and I know what I'm dealing with. I will prescribe Epidiolex, which will be a prescription medicine. I will prescribe Sativex, which is a oil that can be squirted in, and again, these drugs, we have research protocols where people have these illnesses now can go and be part of that study and get the drugs and be safe about it.
But if it was legalized?
You're talking about raw pot.
Well, depends on what the state regulates, I guess.
Yeah.
If it
I
passes.
would not.
Okay, real quick, let me go down to Beth and I'll get to all of yours. Ms. Fultz is going to be first up.
Yeah, we said
Yes.
our goal tonight was to get as many questions in as we can, and we're trying to. We have Brandy Banks here with our next question. Go ahead.
As far as marijuana being considered a gateway drug, do you believe that if the citizens were able to go to a safe, clean distribution center to obtain the marijuana, as opposed to a drug dealer, that it would significantly reduce their exposure to more illicit drugs, thus decreasing the temptation from peer pressure or suggestions from the drug dealer to try something to get a better high?
You would.
Let me let you start.
I have a whole bunch of answers.
I know, it's been a while. Yeah.
Absolutely.
Go ahead.
If it is in a dispensary where you can get a safe medication, let me tell you, if people think that there are not patients that are using it for their pain reduction, they're crazy. People are using it, but they're terrified of going to prison. You have to go and you have to get it illegally. You don't know how it's been grown. You don't know what's in it. As you said, there's a drug dealer telling you, oh, you need to try this. This is even better. Absolutely. As far as, can I ask you a question? Have you ever prescribed Marinol?
Marinol is a good drug to prescribe. It is not very effective.
Would you ever prescribe Marinol?
I will prescribe drugs that are appropriate and for the patient and are legal.
Marinol?
I have once, but it didn't work.
Okay,
and this is another.
can I make a statement about that? Marinol is a synthetic THC. Only THC. Everybody screams about the THC levels. They prescribe Marinol. All it is synthetic THC. There's no CBDs in there, and it has been proven with seizure patients as well as others that you have to have small doses of THC for that seizure medicine to work with the CBDs. Also, in Israel, they have done studies where THC is injected in the tumors. It reduces the tumors and stops the cancer. So
GW.
THC is a huge part of the medical part
It's
of
not
cannabis.
a huge part. The GW in their
Yes,
Epidiolex.
Okay, let Dr. Smith respond, please.
It's about 1% in Epidiolex, which is used.
The THC is
so,
used in the cancer
but as far
treatment.
as Marinol, yeah, I used it once in an HIV patient. It didn't work. We have better drugs. And when we talk about patients, you know, I'll talk about one of my patients recently who had turned down for a heart transplant. His big problem was he was having tremendous pain in his legs. So as a palliative medicine physician, I was helping him navigate some of these problems toward the end of life. But I was also called in because his pain was great. It was in his knees. He wanted to keep going fishing. So with the appropriate medicines, we helped him a great deal. But I asked him, I said, you know, he was an everyday marijuana user. which, by the way, will increase your heart attack incidence by about 5 times. It increases tachycardia. It is not good for the heart, but that wasn't even talked about. But I asked him, I said, well, what does your marijuana do for your pain? Well, Doc, it doesn't do anything, but it just puts me in a zone. And so I think that THC is what most of us, really want, even if we're having pain. But he was very glad to have appropriate medicines to relieve his pain.
All right, we're going to have some more questions. We ought to be able to get at least a couple more in. But first, let's go down to Roby. You have one more poll?
Well, we have another question or two that we can throw in here. We've had a little bit of discussion about the science of addiction. Let's talk about the political science of addiction here. What is public opinion in terms of marijuana being addictive? We asked these respondents, do you believe that marijuana is addictive? 62% said yes, they do believe that marijuana is addictive, to 29% who said no, and 10%, 9% who said they don't know. We also asked, which do you believe to be more harmful to a person's health? Tobacco came in at number 1 at 41%, alcohol at 31%, marijuana just at 9%, so single digits there. So again, just a variety of public opinion about the addictive nature of marijuana and what its harmful effects could be on public health.
All right, Roby, go ahead.
1 in 10 people are addicted to marijuana, okay? That's the adults. When you talk about kids, it's because of their early brain formation and the pathways are different. It's 1 in every 6. If they're smoking every day, 25 to 50% of them will become addicted. That's why we're so worried about children and so worried about the teenagers. We want to be a gateway to protect their brains because they're going to have to live with them the rest of their life. And if most of us, getting my age, we worry about any IQ point that we lose. So when we talk about 8 or 10, this is very frightening. We should be very concerned because it is addictive.
Beth, real quick question.
All right, Blake Crawford is from Hot Springs, and he has our next question. Go ahead.
Thank you. Mr. Bradbury's story began with his son using at 12 years old. The reason is because cannabis is already here. Your children already have it. How is ignoring this what is best for Arkansas? If you want to protect their brains, you do what you've done with alcohol, with tobacco, with prescriptions. You regulate it. How is ignoring this what is best for Arkansas?
This proposal does not do that. This 10,000 word proposal that they're trying to put on the ballot does not do that. It does not regulate marijuana the way we regulate alcohol, not even close. It allows people to grow their own. You can't make your own moonshine, but this would let you grow your own marijuana at home. And it's not, and so you go on to the next,
let him talk, please.
And so if you think that this proposal is going to be some highly regulated apparatus, it's not going to happen. It's simply not in here.
Let me cite this real quick, too. This is from the Healthy Kids Survey in 2013 in Colorado. You guys can tell me if this is what you think about it, but it said 20% of high school kids used pot in the previous month, and 37% had tried it at some point. Now, that's certainly high, but it was down slightly from the previous poll. But then the flip side of that was the perception of harm was down too. 54% say it's a moderate or great risk, and in 2011 it was 58%. So there's an essence here, according to the study, that normalization is created in the minds of our kids, but usage may be down. How do you come to terms with those two things?
Number one, let me address his issue. It is
You're
very
not even
regulated.
listening to me. You know that? You guys, I could just leave the stage.
It is very regulated. Number one, it is regulated. Number two, there are restrictions in there. You don't just get it. You don't just go off and get it. And let me ask you something. You talk about how dangerous marijuana is. There are people who have addictive personalities. That's a proven fact. 9% is the perceived addiction for marijuana. I would venture to say addiction to chocolate, addiction to alcohol, addiction to nicotine, addiction to narcotics is much higher. You can take, and for a perfect example, I had a very dear friend that had hip replacement. She was on an opiate for 1 week. 1 week she was on pain pills. When she got off of it, she was already having withdrawal symptoms.
Melissa, what we have to point out here, though, is that we have genetic predispositions. And what MRI testing shows that when we reinforce those things by using, like in my family, we've got narcotic addiction, we've got alcohol addiction. I don't have that problem. But I have a feeling that if I were to feed that and early on and get these pathways, I could have been just like my good relatives. And because we have to make these choices, if we make and what we found out in these states where medical marijuana is available, more teenagers use it. We also find that the data shows that much of this medical marijuana has been shipped out of state and been sold at large prices. They're coming from these dispensaries that supposedly are well controlled. And so the control issue is really looser than we would hope, even in the best of states. And
do you know that you can get narcotics on the street quicker than you can get marijuana and much cheaper?
I'm going to jump in here real quick.
And it is killing our children every day, narcotics.
It is 7:57, okay? So the time for this town hall to end is 8 o'clock. Now, I can already tell you that's not going to happen, okay? But Beth and I do have to do the news later tonight. So what I'd like to see happen here, we've got 5 people in line, so let's take no more people in line. But if we can rapid fire this, I'd like all of you to get a chance to ask your questions. So Beth, let's go back down to you.
Okay, you recently visited with Denny DeMars, and she's here in the audience tonight to ask a question. Go ahead.
After you said that marijuana is not a medicine, they can't control it, there's not enough testing and all of that, and I'm asking, what about the legal drug Sativex? It's legal in Canada, the UK, they use it for chronic pain, and you want to ask, how can you prove chronic pain? I wish you'd come up with a machine, because I can prove to you what chronic pain is. I guarantee what real live pain is, and I'll trade bodies with you. I wish there was something I could do to tell the doctors when they ask me 1 to 10, and I don't know because I don't know what no pain is. But Sativex is quality control because it comes from the same plant. It's cloned from one plant. It's all put in a machine. It's a whole plant medicine that you spray under the tongue. Everybody says you can't smoke medicine. Don't smoke. You don't have to smoke it. You can. My doctor in Colorado said use a vaporizer. You don't have to smoke it. Why do people keep saying you can't use this as medicine? And you obviously can. It's legal in other countries. I'm sorry, I went too long.
That's all right.
Well, Sativex, as I said before, is GW Pharmaceutical. It is a medication that does have some THC as well as CBD in. It's used for muscle spasticity and for patients with multiple sclerosis and several other indications. So it is a legitimate drug. It's still in the investigational stage to really know what are the indications, how effective it is, what dose to be used, and so it's a very good drug. Now, the difference between it and the one in Colorado, again, we know what's in it. We know the batch, we know the purity of it, and so when we deliver these drugs, we talked about vaporizing. Well, this week in the American Medical Association, talking about e-cigarettes. It seems like that might be safer. We're all kind of excited about it. But in the state of Colorado, there's overdoses from nicotine. The same way, the same machine is going to vaporize marijuana. We're going to have the same problems with carcinogens, glycoproteins, things that we don't know what's in there. And we're going to, again, we've got to be very careful about how we deliver these drugs. But Sativex is going to be it's a very promising drug.
Let me let Mr. Reed respond real quickly.
Back to the survey. The surveys that are done with marijuana as a gateway and a safety issue, if you go back and actually look at the survey itself and the data and how it was collected, very, very few of them that claim a gateway or an addiction ever point out that the question is, which is the first illicit drug you consumed? Not which is the first illegal drug that you could not possess. And my grandkids and my great-grandkids, they alter their state of mind at about 18 months old when they start spinning in the middle of the living room, and then they go, whoa, that was weird, let me do it again. All right, but if you ask a cannabis person in a survey or an intake center about an illicit substance, marijuana will be number one.
All right.
If you ask him which illegal drug that it was not legal for them to possess, it'll be Papa's pain pills, alcohol, and cigarettes before it ever gets to marijuana.
All right. Back down to Beth.
Okay, this is Michael Finley. Go ahead.
Yes, coming from a small farming community, I feel like there's more toxin in your soybeans and rice than there will ever be in marijuana. Another issue is I'm a recovering drug addict, and my main issue was prescribed drugs. So I met a lot of people that would prefer marijuana compared to prescribed drugs. Not to say it's right. And on the regulation part, I have trust in my government and my legislators to write down a perfect law, not a perfect law, but a law that will allow me, as a chronic illness, I have back trouble, that allow me my choice to decide if I want narcotics or marijuana.
Now, here's what I'd like to do. Rusty's telling me that we're going to have to get out soon, and I really want the three left in line to say their piece because you came all this way, and we appreciate you being here. Well, we're going to, Beth, if you can, just let them all say what they want to say, and then we'll get back for final comments from the panel.
We'll go one right after the other. This is Tommy Wright. Go ahead.
For Mr. Cox, you came on here and basically said you're conservative. As a 15-year deputy sheriff in 4 counties in Arkansas, I was one of the most conservative people ever. I've arrested people for possession of marijuana that